Well, new concerns after MSNBC reporter Dasha Burns sat down in an interview with Democratic candidate for Senate in Pennsylvania, John Fetterman.
We had a monitor set up so that he could read my questions because he still has lingering auditory processing issues as a result of the stroke, which means he has a hard time understanding what he's hearing. Now, once he reads the question, he's able to understand. You'll hear he also still has some problems, some challenges with speech. Just in some of the small talk prior to the interview, before the closed captioning was up and running, it did seem that he had a hard time understanding our conversation.
Well, this comes after Fetterman spent most of the summer recovering from a stroke. And now many are wondering, how will this problem that we're hearing about play out during a debate? Plus, if he does make it into Senate, how will he even listen to his colleagues? Here to discuss is trauma surgeon Dr. Manny Sethi. Dr. Sethi, thanks for joining us. My first question is what they're calling auditory processing. John Fetterman has been very open that that is a problem for him. What exactly is that?
Well, effectively, when you have a stroke, there are different parts of your brain that sort of encode language, different parts of your brain that enclose words. And so he has had a stroke that's kind of effectively taken out his auditory processing, or really encoding that language into a way that the brain understands. And so that's why you're seeing him have to read and do this closed captioning stuff. And it's just, it's unfortunate for him. It comes at a very difficult time in a Senate race, but I don't think that he would really be able to carry out, a very stressful role as a U.S. senator. And what I frequently tell my patients as a trauma surgeon, we see patients sometimes with a lot of head injuries, strokes. You just have to give yourself time to heal, and that can many times take 6 months, a year, 2 years. And, would you want someone with this sort of a condition driving your children to school, or would you want them being a pilot of your airline flight, or, in a similar way, someone who can decide whether we go to war with another country, or cast a vote in that regard? And so this is, it's very concerning.
Yeah, and I think, touched on it, but the prognosis, is there always a recovery and it takes a while, or does it depend on the patient?
Well, I think the brain is very plastic and it's very moldable, and but that takes time. And can he recover most of his function? I think so. It's just really hard to know. I was just on a phone call with a patient's family, in fact, talking about head injuries, and what I told them was, this is just like a very new science, and we don't know. But one thing I can tell you is that if he doesn't do the hard work, the speech therapy, taking the time to just have his energy to recover, then he's really setting himself back. And so for his sake and his family, as a doctor, and I haven't seen him as a patient, right, obviously, sure, I would counsel him to just not go forward.
Well, all right, we're going to leave it there. Dr. Manny Sethi, thank you.
Thank you.